Digital marketing in healthcare is a real game changer, and I'm going to take a little bit of time today and talk to you about why and how. The why is pretty simple. Every single one of us at some point in time is a consumer of healthcare. It's just a simple fact. And because of that, healthcare institutions, hospitals, health systems all spend a lot of time and money to try to reach us. They want us to use their products and services. In reality, it doesn't really work like that. In reality, we only pay attention to messages when they're bound to impact us. So people don't wake up in the morning and say, today I'm going to think about my healthcare. If only there were a full-page ad, or better yet, a TV spot, I would know what to do. That isn't the way it works. What happens is we only pay attention to messages when we think they're going to affect us. If we're in need of some kind of healthcare services, we want to look and find those messages, which is how digital really works, because digital marketing is there when and where people are looking for the services that we're selling them. And at Vaunt, we've had a great deal of success working with healthcare institutions to take this digital approach to helping them meet their goals and objectives. One case in point, a 48-bed hospital, and this hospital had an issue with trying to fill primary care patient practices, and they really wanted to get new patients into the system at the primary care level. It's a great entry point for health systems. We helped them with a couple of things in trying to do this. First, we updated their landing page. The landing page for the primary care practices had been kind of disjointed and didn't really have a central look or feel of how you might find a primary care practice. So we helped with that, made it much easier to see the different choices, and we also made it easier to understand why you should have a primary care physician, because that had kind of been missing. The second thing we did was we made request an appointment feature on that landing page. So if you went to the landing page, you could then say, I do want an appointment with this provider in this town, send an email, and we would get back to them with an appointment. Once that infrastructure was in place, it was time for the ad targeting. And the ad targeting was really sort of where we said, we want to reach women who are the primary decision makers in healthcare in this geographic area, and we want to make sure that we're telling them that we have the services and the programs that they need when and where they're looking for them. So it was a very integrated approach, really aimed at sort of trying to find the people who were looking and were in need of our services at that time. I can tell you that it was hugely successful. 6 months into the year, we already had met the goal of new patients for the entire year. So it was very, very successful. We've since taken that same successful planning and implementation and started to use it for specialty care. For instance, cardiology, rheumatology, cancer care, any of these other service lines are really also ripe for a digital approach, because again, with a digital approach, we're reaching them where and when they are interested in our message.